Hello, Career Growth, your own channel for all the concepts of careers, career aspirants, career professionals, everything about career. As mentioned to you earlier, we had told you that we will be interviewing a lot of professionals which will help you to make the right career decisions and make you interact with professional people who are successful and inspiring a lot of youngsters to become successful. Today we have with us Priya Karkera, a clinical nutritionist with specialty in Paediatrics. Hello Priya.
Hi Suchitra.
Welcome. It's nice to have you on our career channel today.
It's my pleasure. It's absolutely my pleasure to be with all of you here.
So I would really like to start with the topic as to what is this field about nutrition all about?
Well, it was never in my list of careers that I wanted to be. It was never something that my parents would have ever allowed me to say that I wanted to become a dietitian or nutritionist. They would have never allowed me to do so. While in BSc, I realized that I do not want to do an MSc. I was very clear that I don't want to do my masters. I don't want to get into lecturing. However, I was often told that you can narrate well, you can teach well, so you must get into the profession. Since I was clear on the aspect that I need to do something in a professional course, so I moved. We had no career growth for us, so I moved my hands and foot. And I found this course wherein they said you can get into a hospital setup. Now, I convinced my parents. I said something related to medical, but it's a paramedical. That's what we are called. We are called paramedicals. Not realizing how much this field would give me in my life, that's how I did my post-graduation in nutrition and dietetics. At that point of time, I entered Hinduja Hospital, which I think gave me insight into what the field of dietetics was. Moving about with doctors, interacting with patients. So it is a lot of satisfaction. Okay, it was like the doctors used to prescribe medicine and we used to prescribe food.
Okay.
So we had to find that adjunct between the two for the wellness of a patient.
Okay.
And at the end of the day, when they were getting discharged, they were like, "Oh, nice, Priya. It was really nice meeting you. You gave us so many tips, which I can take back to my home." So that gave a sense of satisfaction. Since I was not working 9 to 5, I explored multiple things that a dietitian can do. Not just work in a hospital. No. I never entered the gym setup, okay, because again it was a taboo field that you work in a gym, you are called a weight loss dietitian.
So Priya, quickly tell us what exactly does a nutritionist do, or how would we look at a career of a nutritionist?
After 15 years of practice, I'm really happy to share with the generation next that nutrition is not about just diet plans or saying eat this and don't eat this. Okay, it's a very positive field where you have multiple sub fields which you can choose to do. Okay, first thing, I think because it is such a diverse field, you need to identify which diversity is the individual interested in.
Okay.
So it may be sports nutrition, it may be geriatric, which deals only with old people, it may be clinical, which deals with all the medical history or medical problems, it may be pediatrics, which is my key interest, it may be neurology. Of course, we still do not have structured super specialization courses in India as yet. Some courses are just emerging.
Okay.
But we have realized the importance of nutrition and its diversity now in the last 5 years. Whereas in the Western countries, they already have the sub-courses and the sub-specialities well in place. So today when we look at, you need to identify which sub-speciality among nutritionists. So when I say sports nutrition, you'd only deal with sports people. When I say wellness, okay, or fitness nutritionist, she works with gyms. When I say there's another sub-speciality called spa nutritionist who works only with spa. So that goes a lot hand in hand with naturopathy.
Okay.
On the lines of naturopathy. Then you have pregnancy and lactating mothers. A nutritionist who caters only to them.
Okay.
So these are the sub-specializations. It's difficult for us to master all of it. So it's very important when you work in a hospital setup or in a clinic setup. That's why today nutritionists prefer a clinic setup wherein they are able to do only the subspecialties which influences them or which they like. So it's very important, as I said before, that you identify which is the subspecialty that you would like. Now, how do you identify this? Again, that comes with your patient satisfaction. Today, I feel happy when children come to me and say, "Ma'am, yes, I have lost some weight." So that doesn't mean I'm a weight loss dietitian or I'm not a weight loss dietitian, but I'm working with puberty, adolescent children. I'm working with teenagers. I'm working with picky eaters who may be play school going children. So of course, not that they have an illness that's why they come to me. I'm just showing them the right to eating healthy. In the process of this, I'm counseling the entire family. So I would say I'm counseling 4 people when I'm counseling that one child.
True.
So which means I have catered to one family. Now the family speaks to their own brothers and sisters. So it's a big tree or a big chain of wellness that we are creating. With the kind of gadgets, with the kind of foods that is entering the market, I think our work is increased 100-folds.
How does your typical day look like?
As I told you, I like to explore. Okay, I'm not happy sitting under one roof and probably just speaking the whole day or looking at one class of patients. I go to schools. I'm a visiting consultant pediatric nutritionist with schools, wherein I'm looking at the canteen food. I'm doing workshops with the children. I'm doing workshops with the teachers. I'm doing workshops with the parents. Now, as I told you, it's simple 3 different psychologies that I'm using. The teachers, because 8 hours they are with the children.
Right.
Okay. So a different way of how they need not get frustrated with the kind of things that's coming in the different, because there's some setback at the home front for the family. In workshop with the children, I find them overeducated. They are reading food labels today, which is another complete spectrum where a dietitian can get into: food composition, food labeling, food collection, data collection. So that's another complete arena. Then I come into a clinical front where I'm in the hospitals. So wherein I am dealing with sick patients. I know, as we say, medical imbalance which is caused in their lives. Again, the kind of counseling that I do there is different. And I guess at the end of it, every woman is a dietitian of her house. So I look at it that way. If I cannot feed my family of 4 well, I have no right to go and counsel 1,000 other patients. So I become my own role model. I become my own challenge. Because tomorrow, what challenge I am facing as a working woman, definitely probably another working woman would be facing the same. So I think the end of the day, the closing statement would be: work for your family first. Face the challenges. That's when you'll come out with solutions for the challenges when you're counseling.
Wow, charity begins at home. That's what I think what Priya is saying. So that's really nice to know that being a professional and even on the personal front, you're able to balance a lot. I'm continuing with the profession like nutrition, which we today have had an insight about the various options, the various work profiles that a nutritionist can do. I think we need to continue further and meet Priya again in our next episode.